I have nothing to disclose. Studies have shown that lower urinary tract symptoms are anecdotally associated with mood disorders. Indeed, 30% of men and 38% of women with LUTS self-report sufficient criteria for clinical depression. Somewhat surprisingly, the mechanisms underlying this association have not been explored. Until recently, that is, when the medical student in our lab, Nathan Hirshman, presented some work at the 2019 International Urology meeting aimed at investigating this mechanism using the cyclophosphamide-induced cystitis model. While the work received considerable attention, there are severe limitations to the CP model, including possible direct central effects, its acute nature, and the lack of a clinical correlate. Consequently, I am here today to report on results using the bladder outlet obstruction model, which is clearly more bladder-centric and clinically relevant. Now, we have taken our lead in these studies from several other fields, such as IBS, which has shown that peripheral diseases can trigger inflammation in the brain, in particular the hippocampus, which subsequently causes mood disorders like depression. Importantly, this connection was all mediated by a structure in the hippocampus known as the NLRP3 inflammasome, which responds to stress and other signals and releases pro-inflammatory cytokines to trigger inflammation. With this background, we were able to hypothesize that BOO triggers inflammation in the hippocampus that causes depression through NLRP3. We were helped in these studies by an inhibitor of NLRP3 known as glyburide. Since depression has never been measured in animal models of BOO, we had to decide what time point to examine. We looked first at the acute stage, which in rats is 2 weeks following a surgical induction of BOO. There we found inflammasome activation in the hippocampus, but no inflammation or signs of depression. We also looked at the chronic time point of 6 weeks, where we found inflammation, but those rats were still not depressed. Finally, we carried this out at what I like to call a prolonged time point of 12 weeks, and there we were able to gather a full data set to report. The first question was if BOO causes hippocampal inflammation, and if this was dependent on NLRP3. To address this, we use the Evans Blue assay, where dye is injected IV and it leaks into tissues at a rate equivalent to extravasation of immune cells, thus reflecting inflammation. In the case of this brain, this leakage also reflects the breakdown of the blood-brain barrier. As you can see, the hippocampus of vehicle-treated BOO rats had significantly more Evans Blue into the tissues than control or sham animals. And this influx was blocked by glyburide, demonstrating it was dependent on the NLRP3 inflammasome. We confirmed this result by quantitating the density of activated microglia, which are cells that function as macrophages in the brain, in sections of the hippocampus. As you can see, vehicle-treated BOO rats had a significant increase in density of these immune cells, while treatment with glyburide demonstrated its dependence on NLRP3. Finally, we wanted to find out if these rats actually showed signs of depression. So for that, we had to perform 2 different behavior assays. We began with what's called an open field assay, which is more accurately a measurement of anxiety. For this, you place a rat in an inescapable cage marked off in squares and time how long they spend in the middle area. Anxious rats are scared of the open area and basically huddled in the corner or run the edges looking for a way to escape. As you can see, vehicle-treated BOO rats spend a significantly reduced amount of time in the middle of this grid, and this reduction was dependent on NLRP3 because it was inhibited by glyburide. For these behavior assays, we had to perform an additional control, and that is rats treated with the antidepressant fluoxetine or Prozac. Prozac helps us differentiate between 2 depression behavior and sick behavior, which may look similar. However, Prozac will not counter sick behavior, but here you can see it increased time spent exploring back to control levels, indicating this is a true anxious behavior. The second behavior assay employed was the sucrose preference assay, which actually measures anhedonia, or the inability to take pleasure in pleasurable things. For this assay, you simply give a rat a choice of regular water or sugar water, and most of the time they will choose sugar water, but depressed rats don't really care. This is consistent with humans because depressed people don't get up and make elaborate and sweet desserts, or often even flavorful meals. As you can see, vehicle-treated BOO rats consume less sugar water as a percent of the total water consumed. Much like the open field, this behavior was dependent upon NLRP3 and was blocked by an antidepressant. Overall, these results demonstrate that BOO triggers inflammation in the hippocampus that causes depression mediated through NLRP3. We believe that these results are the very first to suggest an underlying mechanism by which LUTS causes mood disorders. Thank you very much.